The Obamacare, which I call socialized medicine, has already been passed. And until we stop that, we really don't have too many choices of other things, because that's being forced down our throat by the federal government. But Missouri voters recognize that. That's why they voted 71%. No, we don't want the federal government running our health care. And so the very first step has to be to at least defund that bill, or defang it, and if we get a chance, to repeal it entirely. The second thing that has to be done then is we have to take a look at our system. And our system, if you look at healthcare and it's sort of in a, the 30,000 foot view, you've got two halves to it. The first half is the care that we provide to American citizens, and a lot of other people come here as well. And the second one is, how do we pay for it? The care that is provided in America, I would suggest most Americans would say, best you can get. You get sick, where do you want to be? Good old USA. The backside is broken, and that is, how do we pay for it? And so we have to work through that process. But we do have an awful lot of experience with free enterprise in America. And free enterprise suggests that you give people choices, and that they have to be part of that decision-making process, and that you don't just have the government run it all, because when they do, it gets terribly inefficient. So you give people choices between different companies, or different policies, or different ways to get their health insurance, and different choices. Do you want a generic drug, or do you want the non-generic? You're going to have to pay extra for the other, and people have to be able to make those choices. We have to get more of the marketplace back into healthcare. So that's a rough direction. First step, we got to stop the thing being shoved down our throat from on high. Yes. I think I'll take one more question.
Assuming you
get a second one?
Yeah.
Anybody got it? All right. We're going
assuming you make it to the general election with Senator McCaskill,
yeah,
and assuming she's strong in Kansas City and she has a strong base too in the St. Louis area, how do you win this race? Is there a certain type of voter, a woman, or a certain demographic, or a certain geographic area? How do you win in the general election if you face Claire?
Well, of course, what you do in this race is you give the people of Missouri the choice of those two futures. They can take a look at Claire McCaskill, take a look at the fact that after the people of this state voted 71% against Obamacare, she continued to vote for it. They can take a good look at the fact that she supported the stimulus bill, which I see we have some state legislators here in the room. And if you think about that, you think about the budget that every state legislator has in every state in the country. You add all of the revenue that states collect to run their state governments, that stimulus bill took a huge bite out of that, probably pretty close to where all of the state budgets were. That's a lot of money. You can talk about earmarks, but you can add all earmarks together the last 10 years, then multiply it by a whole lot more money. Boom, one vote. So I think it's just on the record.
Well, just follow your